It is estimated that about a quarter of the population in the UK are affected by a skin condition that would benefit from medical care. As there are over 1,000 recognised conditions, accurate diagnosis is essential. Dermatology is the branch of medicine dealing with the skin and its diseases, a unique speciality with both medical and surgical aspects. Most dermatologists are skin surgeons as well as physicians and lead the organisation and delivery of skin cancer services, treating approximately 3/4 of all skin cancers. In this programme we hear the views of leading dermatology professionals, Janice Bianchi, lecturer at Glasgow University, Dr. Paul Farrant, consultant dermatologist at Princess Royal Hospital, and paediatric dermatology clinical nurse specialists Janina McMahon and Pauline Scialdoni at Solihull Hospital, who talk about the impact that skin conditions have on patients' lives and the range of treatment options available to them. We also hear from skin condition treatment innovators Molinica Healthcare, Leo Pharma, and Aspire Healthcare, who explain how their technologically advanced medical innovations are helping in the treatment of skin conditions such as psoriasis, actinic keratosis, and eczema.
The skin is the biggest organ in the body and as such has a huge job to play. It's used in maintaining an optimal body temperature, protecting our skin from infection and our internal organs, and has many other functions, including our social perception of a person. As a result, it shouldn't be a surprise that it's vital to keep our skin healthy. Today, we're going to talk about two extremely common skin conditions, eczema and psoriasis. Eczema is an increasingly common condition affecting 1 in 5 children and 1 in 12 adults in the UK. It is becoming increasingly common, and in the past 30 years it has increased 2 to 3-fold. There are many different types of eczema, but the most common is atopic eczema. Our skin needs its own natural oils to keep it supple and to help prevent infection. In people who suffer from eczema, for reasons which are unclear, these natural oils are lacking. This results in the skin becoming dry, cracked, sore and very itchy. Certain products can exacerbate the condition, and these include soaps and exposure to certain detergents. Atopic eczema is a hereditary condition. Sufferers can also be susceptible to allergies to pet hair, to pollen and to dust. Temperature extremes can also make the condition worse. So going from the cold extremes of winter into a warm centrally heated home can cause a flare-up. Eczema can occur anywhere on the body, although most commonly it's found in the creases such as the inside of the elbows and the back of the knees. For people who suffer from eczema, this is not just a skin condition. Often the itch can cause sleepless nights, which can affect the whole family. Eczema can also cause a lack of self-esteem, particularly in teenagers and young adults, as they may not be able to cover their skin. The best course of action to treat eczema is to work with your nurse, GP or dermatology specialist to develop a management routine for you. They will work out what's best for your skin and the triggers you should avoid in managing your eczema. The routine does vary from person to person. For instance, if you're prone to infection, an antibiotic cream may be recommended, or if you're prone to severe eczema or very red inflamed skin, a steroid, ointment or cream may be recommended for use. However, one thing you can be sure of, that any routine you have will include an emollient. An emollient is a clinical term for any cream, lotion or ointment applied to the skin. Complete emollient therapy means that you will use an emollient to moisturise, cleanse and bathe, ensuring that your skin retains moisture all day. Emollient therapy is also recommended by the National Institute for Health and Clinical Excellence as the first-line treatment in eczema. This means that emollient therapy should form the basis of any management plan in treating eczema.
The emollient category is made up of a range of products from lotions which are the lightest through to ointments which are greasier in consistency. NICE guidelines advise the greasier the emollient, the better the effect, as this will help the skin to retain moisture. The issue with greasier products is they may make your skin look greasy. Dependent on the condition, you might want to use an ointment at night or on problem areas. The middle ground is to use a cream where you will still retain a good level of moisture, however your skin won't look too greasy. There are a number of companies that produce emollients and with a number of different brands. The most important thing is that you as the sufferer of eczema or psoriasis commit to using the cream daily and like the cream you're using. A brand like Epiderm is available as a cream or in an ointment, manufactured with clinically proven ingredients that help soften and maintain the moisture within the skin. Both products have few ingredients and no perfumes or colourings. This is because people that suffer from eczema or psoriasis may have more sensitive skin, and therefore the fewer the ingredients, the better. In the UK, you can get a prescription via your GP or nurse, or you can visit your chemist and buy over the counter, or alternatively buy online.
Psoriasis is a common condition affecting around 125 million people across the world. It can range in appearance from mild to very severe. Psoriasis is a speeding up of the usual replacement process of the skin. Normally, skin cells replace themselves every 21 to 28 days. However, for people with psoriasis, this process is greatly accelerated and skin cells can replace themselves every 2 to 6 days. Patches of psoriasis are also known as plaques. These are raised red patches of skin which are covered in a silvery scale. The silvery white scales are the build-up of skin cells waiting to be shed. The redness is due to an increase in the number of blood vessels required to support this cell production. The plaques can appear in a variety of shapes and sizes, ranging from a few millimetres to several centimetres in diameter. Psoriasis can occur at any point in life, affecting children, teenagers and adults. It's important to know that psoriasis can't be passed from one person to another, nor can it be transferred from one area of the body to another. Psoriasis is a chronic condition which can't be cured, but it can be managed. The first thing to do if you or your child develop psoriasis is seek medical advice. Depending on whether the condition is mild, moderate or severe, the doctor may prescribe a topical treatment. This means a treatment applied to the skin. They will also advise you to keep the skin well moisturised and to avoid soaps and other irritants which may dry the skin.
Many people suffer from skin problems. In fact, 1 in 10 of us at some point in our life will suffer some skin condition. Therefore, we need good advice, the right products, and the answers to our questions to help us maintain a healthy skin. If you suffer from eczema, psoriasis, or any other dry skin condition, visit talkingskin.com where you'll find tips and hints on how to look after your skin.
Actinic keratosis, or AK, is a chronic skin condition caused by long-term sun exposure and characterised by slow-growing lesions. AK can occur anywhere on the body that has been exposed to the sun. Identifying and treating AK as early as possible greatly reduces the risk that it will become skin cancer. This is why it is so important to perform monthly skin checks as well as to have your doctor perform annual skin exams. Also, you should see your dermatologist if you notice any changes in your skin.
Pharma is a global pharmaceutical company that was established in Denmark in 1908. That means that for more than 100 years we have supported patients and people living better lives with their conditions. We are particularly passionate about dermatological conditions such as psoriasis and infected eczema. And we have supported healthcare professionals and people with their knowledge base within dermatology and are very committed to do so going forward.
AK, or actinic keratosis, is a sun-induced change in the skin. It has rough skin, slight redness, and it can sometimes lead on to skin cancer. The sun-induced part of it reflects the exposure to ultraviolet light, which patients can also get from sunbeds. AK is really quite common, maybe 23% of people over the age of 60 in this country, more so for men, less so for women, but also affects young people through middle age up to the very elderly. The older you are, the more chance you have of having one, and the more chance you have, if you have one, of having several. Society at large is probably not very well aware of actinic keratosis or how common they are. Some groups, such as golfers perhaps, I've spoken to some golf clubs about the problem, may be more aware of skin problems connected with the sun than others. But generally I think patients come along with a little scaly patch, not knowing what it is.
So patients will present to GPs or dermatologists with either a small mark in the skin, usually a reddish mark, flaky area of skin, or they'll be aware of a textural change, so they'll say the skin's a little bit rough or inflamed in those areas, and that's usually how they'll present. However, a lot of the time people will present with something else, and this will be detected as just something in passing, so they'll come with something else, another skin lesion maybe, and then we'll notice that they have these other lesions, actinic keratoses. Actinic keratoses vary a lot in their look and their feel. They start off as very small, discrete red lesions, often a little bit rough, scaly to touch, but with time they may become thicker and become very thickened on the skin. They may become much more confluent, so they can join up, so the whole, for example, the forehead or the scalp in bald men can become involved.
When I talk to patients about the risk of having an actinic keratosis or many AKs, it really does depend on the amount of sunlight they've had and the number of the AKs they have. One single AK really doesn't confer much of a risk upon their health generally. AKs are known to get better on their own, and I will point this out. If you have many AKs, there is a higher risk of them transforming into a form of skin cancer called a squamous cell carcinoma.
Actinic keratoses are very, very common, and the very small lesions and flat lesions often need very little in the way of treatment. Simple emollients, moisturizers, and sun protection should be the mainstay of treatment for very early lesions. There are a number of other treatments available. These vary from creams to destructive treatments such as freezing and scraping away, a technique called curettage. And for larger areas, we often use another cream and light treatment called photodynamic therapy. So there are lots of different treatments out there, and the key is using the right treatment for the right patient. Cryotherapy is a freezing treatment of actinic keratosis using liquid nitrogen, and it is aimed at treating an individual lesion. However, actinic keratoses are a marker of global sun damage. You don't just get sun damage in one part of your cheek or your forehead. The whole area will have had a similar amount of sun exposure. And we know that those areas are involved, even if we can't detect it clinically, so we can't see change, it's still likely to be there. So the rationale for using cream-based treatments is that you can treat a slightly wider area, and that will pick up some of the early change that you can't yet see. We don't know whether treating actinic keratosis does prevent future skin cancer change, but we all believe it probably does, and that's the rationale for treatment. By treating the field, we're hoping that you can reverse some of that sun damage and prevent future change. The impact of actinic keratoses amongst patients varies very widely. There are certainly patients out there who are not at all worried and won't present with them. And there are other people who will be very concerned about a small number of lesions that maybe from a clinical point of view we're less concerned about. I think overall people aren't aware of the impact of actinic keratoses and their relationship with sun damage and that increased potential to skin cancer. And part of our role is in increasing awareness that these are a sign, and that's not just to patients, that's to GPs too, that patients who have lots of these do need to be taken seriously, they do need to have their skin examined, and one needs to have a higher suspicion for other changes that may represent skin cancer.
As the leading prescription dermatology company in the UK, we provide products, support and training to the NHS and to people living with a skin condition. We also champion awareness of dermatology issues, and we hope to partner with the NHS to increase the awareness of dermatology on the public agenda so it will get the awareness and attention that it truly deserves. We have been committed to dermatology for many years and believe to have a good understanding of the challenges people with skin conditions face. We are 100% committed to help people achieve healthy skin.
Psoriasis is a skin disorder influenced by the immune system, causing scaling and inflammation. It occurs when skin renews itself too quickly and immature skin cells pile up on the surface of the skin. Psoriasis usually causes patches of thick, red skin covered with silvery scales. These patches, called plaques, itch, are sore and frequently occur on the elbows, knees, scalp, lower back, face and palms. Psoriasis treatment depends on the severity of the disease and its symptoms. Topical steroids and retinoids, light treatment and oral medications are all options. Atopic eczema, also known as atopic dermatitis, is the most common form of eczema. It mainly affects children but can continue into adulthood. The number of people diagnosed with atopic eczema has increased in recent years. This could be due to changes in lifestyle or environmental factors that cause eczema, or because healthcare professionals are now more aware of the symptoms.
Aspire Healthcare is a medical technology company, and we're particularly interested and specialise in what are called biofunctional textiles. These are fabrics which have a biological or a therapeutic action, and one of our areas of great interest is a specially prepared form of silk fabric which has been designed to help in the management and treatment of eczema. Dermasilk is a form of therapeutic clothing which has been designed to be used in the treatment of eczema. It is unique, in fact, in that it is the only therapeutic clothing certainly available in the UK which is supported by a considerable amount of product-specific clinical evidence. That's to say, when we were developing Dermasilk, we submitted it to a number of clinical trials in patients to see whether it worked or not. And the results of these trials demonstrated conclusively that it is, for instance, more effective in controlling the itch and inflammation of eczema than cotton, which is a very commonly used base clothing by patients with eczema. So it represents an innovation and an advance in the management of eczema. Cotton was always the traditional advice that doctors would give to patients with eczema. This is the best material to wear next to your skin. Why did they give that advice? Well, there was certainly no evidence to support it, but it just seemed logical because cotton was plentiful, reasonably cheap, and of course it's nice and smooth. But in fact, we now know that if you look at cotton under the microscope, although it feels nice and smooth, it actually consists of a lot of quite short, very short fibres, and particularly when they get rather damp through sweating and so on, they can act as a sort of abrasive pad almost, which rubs on the skin and can actually impair and interfere with the skin and make it worse for the patient who's got eczema. Now, an ideal alternative is silk, which of course used to be extremely rare, very expensive, and has always been associated with that end of the market, but is now much more plentiful. And indeed the silk I'm talking about anyway is a specially prepared medicated form of silk. But the key thing about silk is that it's a single long fibre, so it's very low friction and doesn't rub against the skin. It also has the ability to wick away moisture, so it deals very well with sweat and so on. And as a result, when made up into a material to be worn next to the skin, is ideal for patients who suffer from eczema.
Dermasilk has changed our lives in many ways, more so for Dominic in terms of providing him greater comfort of an evening. Dermasilk helps to regulate his temperature either in the winter or in the summer, which is more beneficial to him. And then of course for us it changes our lives because whilst he's comfortable, we can relax and be comfortable too. Before Dermasil, Dominic's sleeping patterns could be very erratic and very disturbed. He'd wake up frequently, itching or being too hot, or his eczema was bleeding because he was scratching it too much. With the Dermasil, they helped to eradicate some of those symptoms, so therefore his sleeping became a lot easier and he was able to sleep better throughout the night.
Dermasil clothing to me feels soft, stretchy and really comfortable. Helps me to sleep better at night because it stops me from scratching and keeps me cool at night.
We had a lovely holiday in Spain this year. It was very hot, as you can imagine. The weather was fantastic, and it was helped even more so with the Dermasil pyjamas for Dominic, which he wore of an evening to help keep him cool and comfortable. What did you think of your holiday, Dominic?
I thought it was quite nice, and the Dermasil pyjamas helped.
We use Dermasil in our dermatology clinics because we found it's had a good effect on maintaining the children's skin. When they've had quite severe and chronic eczema and we've managed to gain control of it, we've had problems keeping it in a good phase. But by introducing the Dermasil suits into their care regime, it's helped to keep it in a good phase for longer because it's keeping them cooler and less itchy. The Dermasil garments are easy to use because there's no complications in the application of them. They're just literally worn as pyjamas. Some of our children also wear them underneath their school clothing if they find their school clothes irritate or they get hot at school. With the Dermasil, they just get up, they wash, they moisturise. Generally they have their breakfast while their cream absorbs, and then they stick the Dermasil garments on, get dressed and off to school, and vice versa at bedtime. They have the bath, apply their emollients, let it absorb in, and they're just worn as pyjamas. So it's a lot easier than using the double layer wet wrapping technique, or the dry wrapping, which some people seem to use as well. With the Dermasil garments, we generally apply a light application of the emollient because we want it to be absorbed and we don't want the skin to be sticky. So we probably use about 50 to 100 grams of emollient if it's going to be worn all over. With the double layer wet wrapping, we need to be applying liberal amounts of emollient, so we might be using 200, 300 grams, if not more, if it's being used in the garments themselves. So cost-wise, we do reduce the amount of emollients that need to be used.
At the dermatology conference that we attended, the Dermasil products that we came across, we hadn't actually heard much about, so the clinical data was really important. We went away, we read the data, we spoke to the people at the conference, but then we actually tried the products. We spoke to other colleagues and they've tried the product and they'd had great success. So, and it was really important because we needed to know the background and we needed to have the information underpinned. But the actual product itself, with the parents' point of view, that's when we found that it was really useful.
The Dermasil garments, when we request them from the GP, we usually ask for 2 to 3 garments at a time. One reason for this is the cost of them, and it can be quite scary for a GP to see that initial cost. But long term, they work out quite cost effective because they last anything from 6 to 12 months or until the child grows out of them. If you compare them to the cotton suits, where we generally use them double, for the wet wrapping, we need at least 6 to 8 sets of garments, that's the vests and the leggings, and they will only last 20 to 30 days. So cost-wise, they do sort of balance each other out, and in fact, long-term, the Dermasil do work out more cost-effective because it does gradually improve the child's skin condition, therefore reducing the amount of emollients and topical steroids used as well.
The benefits now, after using the Dermasil for approximately 2 years, far outweigh the costs in terms of prescriptions and visits to our GP.
I would recommend the Dermasil product to other peers and colleagues. Just with the experience of the children that we treat, it's made their life more comfortable, even at school time and even sports. My own son wears Dermasil under his ice hockey equipment, and it prevents them getting hot and overheated as well. At school, nurseries and everything, it's made a lot of difference to a lot of children. sleep time, parents are that pleased that the children are actually sleeping of a night time, not waking up, scratching and itching, and they're not having to get up in the night and cream the children every hour. And we found that the product has just made a lot of difference to the children's lives and their families.
Eczema, of course, is a chronic, long-term disease which flares and has remissions, and there's no one quick fix. We all know that. And so inevitably the patient with eczema will require constant management and be on a sort of therapeutic merry-go-round of emollients, topical steroids, antibiotics and so on, sometimes hospital referral. There are good times and bad times. And I suppose the question is, well, where does Dermasilk fit into this? And that's a really important aspect, because Dermasilk is very much a regular daily prophylactic form of treatment. In addition, it's an adjunct to, of course, the therapeutic merry-go-round. But the point about it is that if you can get your patient controlled through your emollients and topical steroids and so on, then the regular daily use of Dermasilk has been shown to maintain that remission and potentially will cut down on further need for topical steroids, potentially will cut down on the need for secondary referral. And so it's very much a part of the management that really should be thought about in the initial stages of the disease, particularly in the very young child who may present at the age of 3 months and be looking at a number of years of discomfort. The use of Dermasilk will undoubtedly benefit that child and help in maintaining a nice level line of treatment and a level line of disease without too many humps and hillocks and flares and remissions, and hopefully without, of course, the expense of secondary referral. So we think the whole area of therapeutic clothing of these biofunctional fabrics is extremely interesting, and it's a new science, it's only just beginning to dawn, really. And so we're going to continue to explore this whole area. In fact, at the moment, we're involved in clinical trials on using Dermasilk material of pants made out of Dermasilk material in the maintenance and control of recurrent vulvovaginitis and also of lichen sclerosis of the vulva. So the area of wound care as well opens up a number of opportunities, and we're currently developing products in terms of wound care and also control of lymphedema using this silk-based material. One of the great things, of course, about biofunctional fabrics is that they're a therapy, but they're a therapy with no safety issue. And that's a very unusual thing to be able to say. Most normal therapies, as you know, will have a downside. There will be side effects, there have to be, but not with therapeutic fabrics. So it's a nice, safe area to work in, and it's also extremely satisfying given the results we've got so far.
We hope this programme has gone some way in detailing how technologically advanced medical innovations are helping in the treatment of psoriasis, eczema, sun-damaged skin and AK. I'm Joanna Lowy and you've been watching Skin Deep in the NHS, Innovations in Skincare.